Some of the worst wounds that I've seen didn't start with neglect. They started with assumptions. Hi, cousins. I'm Dr. Kiki, board certified podiatric physician. There are several reasons why people end up in assisted living facilities. Sometimes it's because there's a cognitive decline and they may not have family members who are equipped with taking care of them. Other times it can be because of um, recent surgeries that affect their ability to get around, knee surgery, hip surgery, and they are there because they need time to heal and they may need someone to help them. Both of these things will have an effect on their mobility. They may now need to get around with a cane or a walker or even a wheelchair. These things create risks, both fall risks and further injury. Many people in assisted living facilities, you will find that there are some vision problems. Maybe due to old age, diabetic retinopathy, or macular degeneration. Lastly, the layering of chronic disease such as high blood pressure, that some of the medications may cause dizziness, um, diabetes, things that may cause, prolonged wound healing. They may be on heart medications, different medications that have various side effects. Some of the side effects may be that, it increases their fall risk. It may make them dizzy when they stand up. It may cause thinning of the skin, things like that. So these are things that can increase their risk of having wounds, and especially foot wounds. Another reason that assisted living facilities can be high risk is sometimes there are gaps in care. Not intentionally, it's just that foot checks are not standardized in most assisted living facilities. Not because they don't want to do them, the employees not wanting to take on the risk, especially if the patient has compromised circulation or diabetes. And sometimes there's no one to train them. I mean, I'd love for there to be a training involved with the CNAs where they can do foot checks. They don't need to be afraid of doing the foot checks, because foot checks are just things that will alert, that can alert the nurses, the RNs, the LPNs to a problem, and they can get in touch with, the podiatrist for that facility. Another thing is that the shoe gear that most people have on in assisted living facilities is for ease. It's for ease. It's for something that the resident can put on and off themselves, or the people assisting them can take on and off very easily. So they're not chosen for safety. A lot of times people are in wheelchairs and they're not actually ambulating. So it's not something that the facility thinks about because they're not walking in it. It's just something that they put on. But they definitely need to be in shoes that are protective. There's still injuries related to being in the wheelchair, even though you're not walking. The other gap is that a lot of times pain is underreported. Especially in memory care and Alzheimer's units, you may not be able to get a grasp on how painful something is. They may not tell you. They may not have the vocabulary to tell you anymore. They may not have the wherewithal to tell you anymore. They may not speak anymore. They may have neuropathy from a variety of processes, and not be able to express pain. So those are some gaps that can lead to foot wounds, not on purpose, but these are things that happen. What families assume when they take their loved one to an assisted living facility is that someone else is checking their loved one's feet on a regular basis. Now, at any given facility, I am there once every 3 months. And that's the schedule that most podiatrists keep in an assisted living facility. The other 89 days, the family is assuming that someone is checking, but that's not always true. Also, the family is assuming that their loved one will tell them if something is hurting. They may not even be telling the staff that something is hurting. They may not have the vocabulary to say that something is hurting. They may forget that something is hurting. So there's a number of different reasons why, they're not going to tell you. So these are assumptions that are made that can be harmful and be the reason for foot ulcers. The last, thing that they assume is if your loved one calls and says, "Oh, my big toe hurts," or "Oh, my feet hurt every day," they may attribute that to just old age. And I know with our elderly population, we like to tell them that X, Y, and Z ailment is because of old age. That's kind of a trash can thing. Now, definitely some things are, especially wear and tear type things, are maybe because of old age, because some of our body parts start to wear out at a certain age. But definitely, if your loved one is saying that something is hurting, have someone check it out visually. Have the doctor of the facility go check it out. Don't just brush them off and say that it's old age. So what should be happening in assisted living facilities? Number one, monthly foot exams by the staff. Either someone needs to train the CNAs or the LPNs. Nothing invasive. Just take a look, feel for pulses, look for any skin tears, those types of things. Secondly, proper shoes. There's too many times I've gone into a facility and the resident has on mixed match shoes or somebody else's shoes. They need to have on proper shoes. And lastly, early podiatry involvement. These are the questions that you need to ask the facility before you put your loved one there. Make sure that they have a podiatrist either on call or on contract so that if there is a problem, your loved one can be seen very quickly. Advocacy is healthcare. Bye, cousins.